Dr. Anthony Collada. I'm a board certified psychiatrist. In this video, I'm going to talk to you about how to deal with different personality types. Now, I got this question asked by a clergyman who deals with a lot of different people, a lot of different personalities, but I'm sure this can help in any particular role where people are dealing with a lot of different people, whether it's in school and work and companies and one's social life. In short, as simple as it sounds, you got to deal with people with love. Deal with them kindly, deal with them in a good way, deal with them patiently. That's all going to have an important impact on how they react and how they deal with you. But in mental health terms and in psychological terms, we can break it down into a little bit more complex matters. For instance, you may have heard of the Myers-Briggs personality types, and it breaks down into different personality scales where you can take a series of questions. You can identify if you're more introverted versus extroverted, if you think more or you feel more, if you sense or you're more intuitive, or you're leaning more towards judgmental or perceptive. Now, that's more psychologically, and as a psychiatrist, I don't deal with that as much as I deal with the DSM-5 diagnostic manual. And the DSM-5 diagnostic manual deals with personality disorders that are a little bit different. There's various categories such as antisocial, avoidant, borderline, dependent, histrionic, narcissistic, obsessive compulsive, paranoid, schizoid, or schizotypal. To complicate things a bit further, people are born with these temperaments or this sort of inner state of being, and where they may be more shy, or they may be more extroverted, or they may be more adventurous or risk-taking. And so each person is sort of born with those characteristics and may or may not have so much that they can do to change it. But this video is primarily going to address how to deal, or what sort of characteristics are indicative of people with the DSM-5 personality types, and some ways to address it. At the end of the video, I'll talk a little bit more about the Myers-Briggs and the psychological aspect. But in short, whoever you're dealing with, you got to deal with them in love, because that's going to help minimize their pathology, and that's going to help them be their best self. So people who are antisocial typically have disregard for societal laws, for norms. They typically break the law. They're like oppositional to authority. They can really just cause a lot of challenging to deal with. These people can get better through group therapy or individual therapy. Many times they're placed in psychiatric hospitals that help them to get understanding of their condition and to help get the therapeutic process started. These people, though, they tend to push boundaries or push limits. And so if you're dealing with someone like this, like in a therapy session, you really need to be firm with the limits you have and make sure that they don't push it or have some sort of boundary set if they do try to push those limits. And any mental health personality disorder, you could consider medications. Like medications like SSRIs can help decrease the anxiety or tension that's associated with having sort of these characteristics. Medications like antipsychotics can help with paranoia or as a mood stabilizer, or there's other mood stabilizing medications that can help if people tend to have mood swings. Another personality disorder is avoidant personality. And these people typically avoid social interactions or avoid being with other people. And often it's because of a fear of rejection or fear of being humiliated or something like that. And so these people can get better in therapy. And the therapist often has to be sensitive to their fears of rejection and encourage them to move out into the world and take risks that may leave them feeling a little bit humiliated at times or rejected or failing. Group therapy can also help these people because they can help understand or give them more understanding of how they are so sensitive to rejection and how that can affect not only themselves but other people as well. And any mental health personality disorder, you could consider medications. Like medications like SSRIs can help decrease the anxiety or tension that's associated with having sort of these characteristics. Medications like antipsychotics can help with paranoia or as a mood stabilizer, or there's other mood stabilizing medications that can help if people tend to have mood swings. Dependent personality, as it sort of suggests, are people who are dependent on other people, and it can get really sort of toxic or pathological relationships because they essentially can't live without another person. And so therapy can help them be more independent, more assertive, can help them rely more on themselves, and it can just help them gain more understanding how much they're dependent on other people. Borderline personality is a disorder that People have really unstable relationships. They can get mood swings. They can have urges to hurt themselves. They can really just flip at a trigger, think things are all good or all bad. These can be very difficult to treat in therapy because they can be so emotional. They can go from loving people or hating people very quickly. There is a specific type of therapy called dialectical behavioral therapy, which I talk about in detail in another video, in which these people are thought to help or benefit from because it really helps them to gain awareness of their thoughts and emotions and some of the cues or triggers that may cause these. And it helps them have healthier ways to react to some of these triggers. Feel free to watch that video if you want to know more about that. And any mental health personality disorder, you could consider medications. Medications like SSRIs can help decrease the anxiety or tension that's associated with having sort of these characteristics. Medications like antipsychotics can help with paranoia or as a mood stabilizer, or there's other mood stabilizing medications that can help if people tend to have mood swings. People who are histrionic tend to be very exaggerated, very emotional. They may be seeking a lot of attention, and a goal in therapy is just help them to understand some of the inner feelings that they're having. A narcissistic personality, I have a whole video about narcissistic personality disorder. These people can be a little bit difficult because they're really self-centered, just look at themselves. They have very little respect or regard for other people's emotions or feelings. And it's difficult to treat in therapy. But essentially the therapist is like a mirror and sort of just reflecting what the narcissistic personality person is saying. And maybe over time they'll realize, hey, I'm being a little bit self-centered, I'm being a bit selfish. And maybe that will help them to change their ways to be more considerate and concerned for other people. Obsessive and compulsive personality disorder is basically someone who's very rigid and set in their ways or rituals. Not all the time do they think of that as a negative thing. In fact, it can be positive in certain professions, like people who have to be very attentive to detail in their professions, maybe like physicians or engineers. You may be able to address some of these characteristics by helping them gain understanding in therapy. Also, with obsessive compulsive personality disorder and any mental health personality disorder, you could consider medications. Medications like SSRIs can help decrease the anxiety or tension that's associated with having sort of these characteristics. So people with paranoid personality disorder are basically paranoid just about anything and everything. They may not be able to respond well in therapy because they have a hard time to trust the therapist. And also they may not do well in group therapy, but they may benefit from antipsychotic medication. So you could consider using antipsychotic medications in dealing with paranoid personality disorder. Antipsychotic medications like risperidone, for example. People with schizoid personality, they tend to focus on themselves or be rather introspective. They may be silent for a long time and so may not do well initially in individual or group therapy, but over time they are likely to open up a bit. And so therapists need to be patient when dealing with someone who's schizoid and be aware of this. So basically someone who's schizoid maybe keeps to themselves. Maybe they don't have much interest in dealing with other people. They may even avoid social interactions altogether. So really have to be patient with them. Patients with schizotypal personality disorder are pretty odd. They may dress a little bit oddly. They may have weird thinking or magical thinking. Like schizoid personality, these patients tend to be a little bit more introspective and focus on themselves and may be silent for a long time in individual or group therapy. But therapists need to really be patient with them and be aware that they may have these odd beliefs or odd thinking or fantasies, and to not ridicule them for it and not judge them, but be patient with them. So as I mentioned how important it is to deal with these people in love and kindness and goodness and be patient with them, it's also important to be aware, are they under any stressful events in their life? Because people who are under stress, they tend to rely on coping mechanisms and they may regress to unstable or bad habits or behaviors. And so when you're dealing with these people, it may be especially important to be patient and be aware of that. In the Myers-Briggs personality types, people are sort of categorized in these different categories, whether it's introverted, extroverted, thinking versus feeling, etc. So people aren't typically always one or the other. There's typically a a continuum. And so it just may help to know some of these characteristics to know how you're dealing with someone. For example, if you're dealing with an extrovert, maybe they won't enjoy having 15 minutes of quiet time. Whereas if you're dealing with an introvert, maybe they won't enjoy being in group settings as much. So just knowing that some of these patterns or characteristics can help you deal with these people.